happy having with us Dr. Alinsod from United States, from California. He's a world leader in urogynecology, and he's the inventor and designer of THERMIva project, this fantastic device which has been designed for the health of women. And he was going to share with us his views, his expertise, and his experience about THERMIva.
Well, THERMIva is a radio frequency device that produces heat given into the genital areas of a woman, middle-aged women, older women, and even young women who have certain problems. It's able to use radio frequency to increase the blood flow, increase the thickness of the skin, to shrink certain areas so that, for example, you don't leak urine anymore or reduce your overactive bladder. So it's a device that uses radio frequency to get fantastic effects on the skin of the genital area. Well, THERMIva came to be about 10 years ago. It was actually designed by me in 2009 when a radio frequency device came to America, and we started using it. All the plastic surgeons and dermatologists started using it on the face, and of course I get the machine and I started using it on the genital area because I'm a gynecologist, and I saw that it would shrink the skin dramatically. So I thought, this is tremendous. I wonder if we can design something to work inside the vagina gently, comfortably. Will it help the women? So we found it to be a tremendous device in the United States and now in over 42 countries, including Greece, to help women with feminine needs, specifically with menopausal symptoms for the older or middle-aged women, and also for the young women to help tighten the tissues, make it look like a youthful vulva and a tighter vagina, and improve the sensation of women.
So all the work of Dr. Alinsod, and I got contact with him, and I went to California to his headquarters to be trained, because I wanted to be trained specially from him. I didn't know just to buy the machine. I wanted to see from his huge experience about the device, who actually was his invention.
THERMIva, I designed it originally to shrink skin. It's approved in the United States for dermatologic condition. And what's dermatologic condition? Dry skin, loose skin, insensitive skin. So those are the main areas I designed it for. But once I started treating the inside of the vagina, it tightened the skin on the inside of the vagina too. It tightened the skin, but it improved the blood flow inside the vagina, so that with an increase in blood flow, there was improvement in moisture production. But as I used it more and more through the years, I found that it also shrunk tissue. It was designed to shrink skin, and so it shrunk the skin that was underneath the bladder. So it helped lift the bladder a little bit, and it helped lift the urethra. The urethra is where the urine comes out. And it made patients have less accidents when they would cough, they would sneeze, they would jump, and they would have to wake up fewer times in the evening to empty their bladder. Well, in general, we tell the patient to come in for your first treatment, which takes about 10 to 17 minutes, depending on what you're trying to treat, and repeat those treatments every 4 to 6 weeks for a total of 3 treatments. First of all, THERMIva increases the collagen and elastin. Those are things that thicken your skin and make it flexible. Laser treatments increase collagen, and so that the skin gets thicker and gets brand new, but it also sometimes, with multiple treatments, can leave a rigid vagina or vulva because it does not increase elastin. Lasers, after treatment, put thousands of holes on the skin. It's called fractional therapy. It puts thousands of holes in the skin to damage the skin so that the body has a healing response. And when the body has a healing response from the trauma, it produces increase in collagen and blood flow, and that's why moisture improves and skin improves in laser treated skin. Radio frequency does not put any holes in the skin, and it does not damage the skin, and in fact it stimulates new collagen and elastin production, and also stimulates new blood flow to come in. So there's no actual physical damage that you can see on the skin. Everything works in the microcellular level.
I have the same experience from my short period in Greece with THERMIva after my training with Dr. Alinsod, that patients with laser treatments, they have huge complaints about long-term vaginal discomfort, vaginal discharge, vaginal infections. They were experiencing pain during the treatment.
Well, this has been well received in the entertainment industry in Hollywood. I know that shouldn't be how you judge devices, but the acceptance has been quite widespread. And now, when you say THERMIva in the medical industry and entertainment industry in Hollywood, people know what it is. THERMIva has become the Botox of genital devices. I have treated patients as young as approximately 20, 21 who just had babies and they're feeling loose. And my oldest patient, I treated patients in the 90s, in their age 90s, who, they're in California, they're still sexually active and very, very healthy patients, and they want to be normal again. In general, I looked at all my statistics. There have been over probably close to 120,000 cases and 30,000 women treated worldwide. I've looked at my cases, and the average age of patients getting THERMIva treatments are approximately between 40 and 60 years old.
Although initially our target was the menopausal women, or the age group between 45 and 65, we found that a significant amount of women in early ages, especially after giving birth, they have serious problem about laxity, vaginal laxity, pain during intercourse, not feeling intercourse, dry vagina, especially when they're breastfeeding.
One more new evolving field we have started using THERMIva for are the women who are having a hard time achieving orgasms as they age. They either cannot achieve it, or it takes so long to achieve it they lose interest in sex. In 3 out of 5 women who was unable to achieve an orgasm for whatever reason, once we treated them, they were able to achieve an orgasm finally. Now I'm asked on where THERMIva is going in the future. I see it this way. I see THERMIva as being the core of a gynecology practice, the core of a primary care practice, because it can help the person, the woman who just had a baby. It can help the middle-aged woman who's loose or has lost the ability to achieve a consistent orgasm. And as they age, it can help the woman who is dry and having painful sex. I see it all going towards prevention in the future.
I practice THERMIva in my private office in Athens, in Marousi, since 2017, where I was trained with Dr. Alinsod, and I brought the device in Greece. We're treating patients here with huge success, and we're collaborating also with Aesthητική. Red, I'm very happy that you are with us here in Greece. You had a long journey.
Thank you very much. It's a pleasure to be here. Thank you for the invitation.
Thank you very much for coming here.